Good morning, Jill Lindholm here, licensed alcohol and drug counselor. It is currently February 7th, Sunday morning. Good morning. And I would like to touch base on doing another blog. But before I do that, I think this little picture up on my computer here I chose for this blog today. Question that people normally answer, or ask I should say, is addiction a disease or is it caused by a lack of willpower? I could have this as a subject all on its own, but that's not really the subject that I want to touch base on at the moment. But the answer to that is addiction is a brain disease, not a moral failing. It is genetic, it is chronic, it is progressive, and potentially fatal if left untreated. The American Medical Association labeled addiction as a disease more than 70 years ago. It should be viewed like any other chronic illness, such as diabetes or hypertension, just as two examples. Now, the blog I want to do today is kind of a serious nature. I mean, addiction is a serious nature in general, but I chose blog 39 today to be called Links Between Addiction, Mental Health, and Suicide, which all are very serious in themselves, so I consider this a very serious blog to discuss today. But I have some information I would like to share with you, and we'll start with when a loved one is suffering from an alcohol or drug addiction, it is common to feel fear. Fear that one day you will get a phone call that your loved one has been in a serious accident or has overdosed. But what many people neglect to think about is the possibility of suicide with this disease, which is undeniably linked to alcohol abuse and drug addiction. In the U.S. alone, over 40,000 people committed suicide in 2013, which works out to be over 100 people per day who took their own life. Suicide is the 11th leading cause of death in America. Depression and other mental health disorders are the leading cause of suicide, followed very closely by alcohol and drug addiction or abuse. In fact, research shows that alcoholism, not a psychiatric diagnosis, is the #1 predictor of suicide. Alcoholics were found to be 5 times more likely to eventually commit suicide than non-alcoholics. The links between addiction and suicide. Many people who abuse drugs or alcohol have underlying depression, anxiety, or other mental health disorders, and will use substances in an effort to self-medicate. In the beginning, of course, having a drink or using drugs will seem to get rid of the problem, but the fact really is it will only increase the problem over time. Without learning to properly cope with the underlying disorder, it will require even more drugs and alcohol to seemingly keep it at bay. And eventually substances will no longer work and the problem will actually be worse than it was in the beginning. Even in users without underlying mental health issues, alcohol and drug addiction can change the brain chemistry over time, actually causing disorders such as depression, anxiety, and mood or personality disorders. Another factor that links addiction and suicide is that many addicts begin to feel that their life is out of control. When an addict realizes the control that the drugs or alcohol has over his or her life, a feeling of helplessness can often take hold. At this point, the best case scenario is that they reach out for help and enter some form of an addiction treatment program. But the worst case scenario is that this feeling pushes them deeper into their addiction with no obvious way out, and an addict feels overwhelmed by these emotions. Suicidal thoughts can often take over. Of course, getting an addict into treatment as soon as possible is the best way to overcome the threat of suicide, but that is not always possible. And even if they enter rehab, suicide risk does not disappear just because an addict is in recovery. In fact, for many addicts, recovery can be even more a difficult time, which creates further suicidal thoughts. What leads to suicidal thoughts in addiction recovery? Addiction recovery can be a scary time for addicts and can contribute to feelings of suicide in the following ways. Number 1, learning to live substance-free. One of the scariest times for addicts is when they complete drug or alcohol rehab and have to return home to get back into normal life. Life becomes completely different. It becomes too dangerous to hang out with old friends, and old hangout spots become triggers for relapse, meaning that life after rehab is often similar to starting over completely. For some, they may have to move in with friends or family if they lost their house to their addiction. These unfamiliar experiences and new feelings can quickly spiral into suicidal thoughts if the addict does not use healthy coping skills to help them move forward in a positive mindset. Dual diagnosis. It is important that an addict attends an addiction treatment facility that is equipped to not only understand but to properly treat addicts with co-occurring disorders. Over half of all addicts are dual diagnosis individuals, meaning that beyond addiction they also suffer from another form of mental illness, including anxiety, post-traumatic stress disorder, and depression, and personality disorders, among others. If a rehab facility is not properly equipped to deal with these co-occurring disorders, once the addiction treatment is complete, the addict will start and still be left to deal with their second mental health disorder separately, or in many cases not at all. If an addict has not been diagnosed properly in treatment, they will not understand how to cope with this other mental illness, which can leave them once again with feelings of helplessness and despair, which can lead them to suicidal thoughts. Number 3, feeling overwhelmed. Addiction recovery is overwhelming, even on the best of days. Aside from trying to start your life again with a fresh slate, knowing that recovery is a lifelong journey that is never officially complete can make anyone feel like giving up. Unfortunately, there is no quick fix to recovery, and it is something that takes work each and every day. For some, knowing this can make them feel utterly depressed, and suicidal thoughts can creep in. Non-positive circumstances. One of the biggest relapse triggers, which can also cause suicidal tendencies, are non-positive circumstances or trauma. For example, if someone close to the addict dies, they will automatically want to pick up a drink or use a drug. If they cannot find a job or feel lonely without their old friends, they may want to drown their sorrows in a bottle or shoot up. Breakups, chronic physical pain or ill health, financial or legal problems, lack of direction in life, all of these things can be detrimental to an addict's recovery. Many people are able to use the coping skills learned in treatment to get through these circumstances alive and sober. But if a relapse occurs, this can bring feelings of shame, guilt, and worthlessness that can lead to suicidal thoughts. I am going to stop here and name this part 1 of Links Between Addiction, Mental Health, and Suicide, blog 39. And I will come back with blog 40, which I'm going to talk about warning signs of suicide and addiction and recovery, because I think that's important and that needs to stand alone for understanding. So, counselor out for now. Jill.